Now more than ever, innovative technologies are fueling change and sparking new ways of thinking. Collaboration between corporations and startups is key to staying at the forefront of these trends. However, finding the right startups can be expensive, time-consuming, and ineffective. But Plug and Play is here to help. As a corporate partner, you will gain access to a whole ecosystem of innovation. Discover startups that meet your tech interests. Stay updated on the latest trends and network with industry peers. We will help you during every stage of your innovation journey, no matter where you are and where you want to go. Get in touch today.
Good morning, everyone, and thank you so much for joining us today for our webinar, Healthcare in the Metaverse. My name is Ava Ascari, and I'm the Senior Program Manager for our U.S. Healthcare Accelerator program here at Plug and Play. I'll be the moderator today. Let's get right into the agenda. I'll give a few quick remarks and then we'll dive into our featured speaker. I'm super excited to welcome Paula Kranz from Novant Health to give us an overview and sort of a lay of the land for healthcare in the metaverse. And then we'll hear from 5 of our program startups and portfolio companies that have healthcare use cases for the metaverse as well. So I'd like to remind everyone that our summit is coming up and it will be in person this year. And we're so incredibly excited to get back in person. We'll be in Sunnyvale in Silicon Valley from June 14th through 16th. We'll have about 250 startups that'll be presenting from 17 different industry-specific programs that we have. And we'll have lots of awesome keynotes and other events going on. So if you'd like to join us, please feel free to reach out to myself or someone from our team directly if you have a connection to receive some more information on that so we can get back in person with us. So just a reminder too, for the Q&A in the chat, if you have any questions, please put it in the Q&A box. And if you have a general comment, you can put that in the chat. So let's get right into it. This webinar is a part of our 12-week accelerator program. We have 12 startups selected for our batch 14 that are right now engaging with mentors and VCs and our corporate partners. And we strive to bring you topics on these webinars that are current and relevant and relate to the different stakeholders in our programs. So we chose this topic specifically because we've all heard about the webinar or about the metaverse and Web3, but we really wanted to dive a little bit deeper into what this would mean in the context of healthcare and what the future of healthcare could look like. So I'm really excited to announce our featured speaker, Paula Kranz. Paula is the Vice President of Novant Health Innovation Enablement, and she's the Executive Director of Novant Health Innovation Labs in North Carolina. She previously served as CEO of MediXR, which is a digital health consulting firm with a focus on immersive technologies. She also served in the U.S. Army for about 23 years as an intelligence officer and later taught at Harvard, Tufts, and West Point as an academic. She serves as a corporate and nonprofit board advisor and was a New York Times bestselling author as well. So without further ado, let's welcome Paula to the stage to talk healthcare in the metaverse. Welcome, Paula.
First of all, thanks again for the introduction. This is a mural we just painted in our innovation lab in a section called our Immersive Alley. We call it this area, the Novant Metaverse as well. So you can kind of see that in healthcare, we always try to keep the human in the central aspect of what we're doing. But we've included this, there's a brain and a cerebrum up in the right corner with a circuit board in it. We have helixes going through and they're connected with circuitry. If you've done any kind of virtual reality experience in the gaming world, you can recognize the landscape on the bottom. And then on the left, we have this city skyline of Charlotte. And we've translated a quote about innovation into bits and bytes. You can't see it so well here, but basically it says, it's not enough to incentivize innovation. You have to create a space to experience it. So that's why we created a physical lab for people to come and experience all of our emerging tech. But I'm particularly passionate about the immersive space. So a quarter of the space is dedicated to that. Just a little bit more background on me. I've been immersed in the immersive world, if you will, since I went to the United States Military Academy. We use this space to visualize both sports performance optimization as well as preparation for combat. And throughout my career in the military, we did a lot of this both for combat preparation for new experiences we hadn't experienced before because of the changing nature of warfare, but also for treatment for post-traumatic stress disorder. And I just realized that there's such a power in placing people in these experiences. And as most of you probably know on this call, there is actual medical evidence to show that. Brain scans that show how different parts of the amygdala are activated when you're in these experiences. So I love what this mural brings to life. What I'd like to focus on next is just what exactly is the metaverse? How do we define it? So technically, Webster's dictionary says it's a virtual space in which users can interact with computer-generated environment. There may be a human environment as well. So most of you probably played Pokemon or done some kind of face filters on Instagram, for example. I'll get into some of those examples in the future. But broadly, it's a virtual space for interaction. The concept applies to how we interact with this type of technology. So I wanted to outline here some of the properties of the metaverse. So it can be massively scaled. Some of you may have heard of an organization called AltSpace. This is a virtual environment where if you have an Oculus headset, you can sign up for an account for free. If you want to go and find a group in a room that is focused on grief counseling, you can show up as an avatar there and literally interact with other avatars, which are real humans, and discuss and share whatever you're grieving over. There are other kind of user groups that can meet up in that space as well. But this is a globally accessible entity, which is really, really unique way of bringing people together. Secondly, it's interoperable. So you can basically create a digital twin, right? So what happens when one virtual world can easily be ported into another? Now, whether that's you're bringing IKEA into your living room, or in the healthcare space, we're bringing patients' DICOM images or other imagery into the OR for more precision applications. Third, it can be real-time rendered. So you, in any of these spaces, you're interacting in real time. Fourth, they present 2D and 3D virtual worlds. So you've probably used your phone for the Pokemon or the face filters. Some of you have probably used virtual or augmented reality headsets. And most of these you're able to view the information, the data in a 2D or 3D virtual way. Fifth, it's synchronous. So multiple users can interact synchronously inside the metaverse. One thing Novant is looking at is we have a dispersed workforce. We have 37,000 employees in 4 different states. So we're working towards a point where we give every employee a headset and they can meet up with other team members in this space to practice a surgery if they're a medical student, for example, or to do de-escalation training if they work in emergency departments together. Or everyone can go into this space and meet up for a summit on diversity and equity training. Last but not least, they're persistent environments. So users' data will persist into perpetuity, allowing users to own things like property. So if you've done any gaming or your kids do any gaming, in my case, you can see how they build these outfits to wear, and they build homes and they build spaces where they continue to add different properties. So the same thing in healthcare. We can add new operational equipment for the OR, new tools that we might be experimenting with in that space, and continue to grow the capability. So some trends in the metaverse, you can see that major corporations are predicting and investing in various aspects of the metaverse. I'll just give you a second to reflect on this screen. As most of you know, Facebook recently rebranded itself as Meta, and they've invested over $10 billion in a new division that's focused on this particular field. So a lot of this has really grown with the adoption of 5G, and a lot of the headsets that we're looking at have their own capability to connect, to have connectivity. That's a big issue because health equity is really important to us. So if we're sending these virtual reality headsets to a user for home-based rehab, and they live in an underserved community, or they can't afford Wi-Fi themselves, the tools that we're using to deploy this technology need to be self-sustainable and connected. So Ava mentioned Web3. Just to do a little 101 here, most of you probably know this, but some of you probably are not old enough to remember the beginning of Web 1.0. This is probably when I was in college and the web was read-only, right? Google, MSN, Yahoo, there was really no way to email or connect with others. Web 2.0 was much more participatory and became much more centralized. Most of you, I'm sure, use all of those apps you can see there. Web 3, now some of you may not recognize any of those symbols or apps, but Web 3 is really focused on having no intermediary and being very decentralized. So it's accessible to all. So really aligns with our focus on equity, access. You can view a vision of this in a company called Decentraland. I've put the link here in the third bullet to check it out if anybody wants to know a little bit more, but you can see how we're building all these universes, rooms, environments in a space that's very accessible to anyone. So what are the opportunities in this space that we're thinking about for healthcare? I broke it down into 4 categories: provider focused, direct patient care, retail, and passively assisting patients. So I have some examples in the next column, but I'll dive into these a little further in future slides just to show you exactly what our healthcare system is doing. The big categories are realistic medical training. I think that's where the big moneymaker will be if you're a startup and looking in this space. The most prevalent use cases we're looking at are in behavioral health. And so those are like little bit lower stakes, as in you don't have to get FDA clearance to use it. So a little easier to adopt. When there's new technology out there, it's always a challenge to get a workforce to adopt it, to believe it, to understand that a patient using it or a provider using it is not susceptible to a cyber attack, for example. But behavioral health is where we've been able to get some early successes and then build towards adoption for medical training, telemedicine, some of these other categories. I'm going to get into our use cases next. So we have a workforce that is experiencing significant burnout. Some of our ICU nurses are registering burnout at a 70% rate. Physicians have a 2 times the suicide rate as the normal population. So we're deploying these headsets in our respite rooms. The average healthcare worker sees 15 deaths a year. So you can imagine seeing somebody die and then having to go right back to work is very difficult. I've served in combat. Seeing one death can be debilitating for the rest of your life. So in this particular instance, this is a company called Helium. The user wears a headset that registers his or her brainwaves and breathing, and a cognitive behavior chatbot, if you will, is embedded in it. So this person chose to go to the beach, is getting guidance on breathing in and breathing out, and bringing their stress and anxiety down. We're also using these in our oncology suites. Some patients have to sit in an infusion center for 4 to 8 hours without any form of entertainment because they can't afford a phone or don't have a television. So it's just a way for them, if they're afraid of that chemo treatment or feeling lonely, to go into a headset and go to Paris or meet a family member. Some of these headsets have the ability to bring in another family member as if you're doing a FaceTime, but you can be in Beirut or Ouagadougou together doing trivia or just climbing a mountain. I mentioned our immersive alley, and the bottom is a picture of it. We have lots of groups coming through this space from our community, kids who are interested in STEM. We're trying to inspire them to embrace this metaverse, to our workforce. I mentioned we have 37,000 employees, and I've spent the last 1.5 years trying to help them understand the power and the efficacy of this space. And now we've got everybody demanding it. It's a good problem to have. So bringing these things to life, it was hard at first, but now that we've educated the workforce, we're able to deploy about 37 different use cases of immersive technologies across Novant. I mentioned the medical education. So we've got a space where our MedEd team, which is part of the School of Medicine at Chapel Hill, are bringing their younger physicians to come and train, and they're particularly excited about it. So for those who are kind of new to the field, there are some really, really powerful applications in pre-op planning. We see having these tools as a recruiting tool for physicians who are like, I want to work at a hospital that is using the most cutting edge technology for me to help be the best version of me and to have the best patient outcomes. So this is Dr. Rob Lewis. He's a neurosurgeon at Hope Hospital in California. Some of you may have heard of him. He uses the surgical theater to take patients through their own anatomy. So literally fly through their brain to understand the anatomy of a tumor and discuss what his plan of approach will be to attack that tumor, if you will. I think it's transformational for patient education and engagement. And Dr. Lewis says it's helped him to really refine his surgical approach and improve outcomes. We're also working with another company called Precision OS. So this is focused on orthopedics. But imagine before you do a scoliosis surgery or a hip replacement that you and the surgical team can literally fly through the patient's body, pull out an L5 or the pelvis and examine it before you have to go in and do some kind of reconstruction. You could even test implant trials in such a situation. So we're really excited to be the first healthcare system bringing precision to life. They've only worked in academic settings in the past, but just got their FDA clearance. And Novant is really excited to be able to partner with early stage companies to help shape the technology. So keep us in mind in the future. You can see the value proposition with Precision OS on the left. We're deploying 30 of these headsets with our medical education and our orthopedic and spine surgery institutes in the next year. I mentioned workforce getting together. So here's just an example of Meet in VR, which imagine anyone around the world can meet in this virtual conference room. You could have a PowerPoint being presented. You could have sidebar discussions. So this is very much a reality already happening. Might be kind of slow adoption in the healthcare space, but I see it as the future for collaboration. I know in my previous job, I used to produce virtual reality content, and we worked with automotive companies who were bringing their engineers into the headsets to design new Teslas or new Fords. And imagine you don't have to use a drawing board. You can use a virtual paintbrush, if you will. So creative way to bring new things to life. I mentioned all the behavioral health use cases. I've listed a few here for which we're seeking solutions or have partners in place. Really powerful. The brain is tricked into thinking it's in a certain environment. In this case on the right, it's Oxford DR, and they're doing exposure therapy for someone with fear of heights. I've tried this experience. If any of you have had to walk the plank or walk across an open area, it's amazing how your brain is transformed into thinking you're really in that space. Next, I'll kind of briefly talk about augmented reality. So augmented reality, you're not wearing a headset, you can see the real world. We're using this to give our donors and patients tours of our facilities. So 360 video of, let's say, a children's cancer center or obstetrics ward where someone's going to be giving birth. A lot of people are very afraid of coming into hospitals. So if you give them that chance to have a little exposure therapy in advance, it can be transformational for their experience. The second image is wayfinding inside our facilities. We have 15 hospitals and 500 clinics, and a patient, on one day might have to go to the pharmacy, the radiology lab, a blood lab draw, and then back to their physician's office. And it's actually quite easy to get lost in the facilities. So we're working with innovative ways to use augmented reality for navigation. And then on the right is an image of something we're using for patient education. So this is more for our community engagement, but you scan a QR code and you can pull up the brain and explain, here's the anatomy of the brain, here's the tumor, here's whatever it is the participant needs to see. So I think you have some startups today who are focused on augmented reality, and just wanted to show some images I pulled offline. This is a new field for us, and still somewhere we're climbing the hill, if you will, to educate our workforce on the efficacy of the technology. So the HoloLens from Microsoft, you can see the full room, but a patient's DICOM image or other images are brought into the field of view, and everyone wearing the headset can see the same image. I won't steal the thunder of some of the presenters later today, but this is, I believe, the most transformational technology in the metaverse. So imagine if you're looking at somebody, a physical patient on the operating table, and you're going to do, let's say, a lung biopsy or a liver biopsy, and you can see their anatomy through your glasses, and you can see the tumor. So you're looking through the glasses for an image-guided procedure for an ablation or diagnostic work, instead of looking up at the wall at a 2D image that looks like, a basic ultrasound. So really transformational for lots of reasons, improving patient outcomes, but also ergonomics for the physicians. So some other kind of things Novant Health is looking at, we're trying to give patients the ability to see their digital twin, if you will. So using these smart televisions on the wall so they can see everything about their personal health, their caretaker can see it. They constantly have an understanding of what's going on with their care plan. On the bottom left is a company called Accuvera. So we use this, or we're looking at using this for fall detection. And it's basically thermal cameras that using algorithms can detect and predict if somebody's going to fall out of their bed based on their movements. On the top right is a company out of Europe called Evolve Rehab. So basically they use a Microsoft Kinect camera, which is as most of you know, for video games, but it can trace a person's movement and basically gamify the rehab process. So you can see on the bottom right, you have to row the oars in a certain way. Maybe that person's doing shoulder rehab. This is something we're about to build at Novant. So this is a precision wellness focus initiative. And I think the metaverse is going to help this a lot. So if you could have an image of yourself and maybe your goal is weight loss and you want to see what you would look like, you know, if you did a certain type of training, whether it's weightlifting or running, and you can envision a leaner version of yourself, we're thinking that can possibly motivate different behaviors. Likewise, if you see images of yourself being artificially aged, you know, maybe you would actually start to wear sunscreen. In the bottom middle is a Tesla haptic feedback suit, and this individual is wearing a virtual reality headset. So while this is currently used for gaming and sports, we're hoping to use it for rehab. There are 500 sensors built into that Tesla suit, and it's communicating with the headset. So the individual is getting feedback on whether he's swinging his golf club correctly, or in this case, doing the right type of rehab. But you can see it's gamified. He's got these sabers, but he's got to lift the sabers in certain ways and slay different things that are flying at him. So I know time is short, so I'll stop with this slide, but really what the metaverse will provide for us is more precision wellness. I talked about VR, AR, and XR. I didn't mention 3D printing, but it's kind of an extension of some of these, but it's really enhancing the way we provide patient-specific pre-op planning and education. So it's not one size fits all, it's custom medicine for you. And whether that's pharmacogenomics or that pre-op planning you saw, or 3D printing your spine before we cut you open and operate on it, really, I believe, transformational. Another category is all the wearables and remote patient monitoring devices. So you can see earrings and socks that detect pressure changes and insoles that can detect gait problems or maybe weight problems, and they communicate via Bluetooth to your electronic health record. What if you're tracking all of that in a virtual environment, and it can help you improve your health? So it's knowing as much about you as possible to help you be the best version of you. The other thing I'll mention is the focus on molecular diagnostics. So we talked about, or one of my slides mentioned digital twins. So basically a virtual version of you that your surgical team can practice on before they operate on you. Well, now we can do this down to the molecular level. If we can look at your genetic coding and your cell growth, we can see, we can model how your body, maybe a tumor is going to expand over time. So breast cancer spread, right? So really powerful use of molecular diagnostics in the metaverse as well. So I will stop there. Eva, I don't know if we have any time for questions because I got excited and talked too much, but I'll turn the mic back over to you for now.
We do have time. I do want to get to a few of the questions, and thank you so much. This is fascinating. I think there's so much in here that a lot of us just weren't aware of, and it's very eye-opening. I want to get to the first question. Someone had asked, curious what challenges you've had with adoption, either patients, physicians, or others who may be uncomfortable trying new AR or VR tech, and how are you working through that?
Well, that's a great question, because I think if you're a startup, or if you're in my shoes trying to bring this new technology to life, there's kind of 4 principles. One, you have to communicate the big idea, and that is that the power of this immersive technology is transformational. But it's not enough to communicate. You've got to give people a chance to try it. So we've spent the last year and a half at the grace of vendors who kind of lent us headsets as demo models, and we've taken them out to the field, and we've taken them to our rehab team, and we've taken them to the neuroscience team, into the pain management team, into the OBGYN team. We said, you just try it, and you'll believe it. We have now 3 innovation centers launching, and people can come into the immersive alley, if you will, and try it. And so, getting the big idea right, communicating it, giving people the opportunity to try it. And now we're at the stage where we're institutionalizing it. So we're going through any adoption of new technology in a healthcare system has to go through a kind of security, cybersecurity, protection of personal health information security. We call it an application service design process to make sure that that technology will do no harm. And in fact, we might do studies to show it can do well. So we're partnering with startups in this space to do research studies to raise the knowledge in the field, right? Until the FDA approves some of these, adoption will be lower. But we had to push the boulder uphill, but now I would say people are demanding People are giving us money. Our foundation is reaching out and saying, can we have some kind of virtual reality deployed? I literally got a text this morning asking, do you have anything in virtual reality for pain management? So it's a good problem to have.
Yeah. And do you see the adoption of this technology primarily through B2B channels or B2C?
Both. And in our case, it's B2C, but we're buying the headsets and contracting with these companies and providing them to our patients, if you will. Now, in some cases, because we're still working on the insurance reimbursement and FDA clearance, the VR company may send the headset directly to the patient. Patient has to pay for it. It's not reimbursed. It doesn't really go through us at all because we don't have a full fleet of team members who are ready to, if something goes wrong with the headset or to administer it. So it's kind of both, but I would say for us, we're doing B2C right now.
Wonderful. Well, I think that's all the time we have today. There's a ton of questions in the Q&A. I know everyone's really excited about this topic. There's so much to explore. Really, really appreciate it, Paula. Thank you so much for joining us. I'm not sure if you have time to stick around and maybe answer some of the questions in the Q&A.
Yeah, I'll put my email in the Q&A if anybody wants to reach out. I'm very passionate about supporting this cause, serve on an FDA advisory board, and just want to see adoption. So if we can help in any way, let me know. Thanks, Ava.
Wonderful. Thank you, Paula. Thanks so much again for joining us. And now for the second half of our event, I'd like to welcome the 5 startups that all have sort of these health use cases for the metaverse. Each startup has 5 minutes to pitch, and we'll have a few minutes of Q&A. So if you have any questions, please feel free to drop them in the Q&A box. So with that, first, I'd like to welcome Exploro. Exploro is a platform that uses AR gamification and AI to reduce anxiety for young patients going to the hospital. So let's welcome Exploro.
Hi, I'm Dom Rayburn, and I'm the CEO of Exploro, a patient engagement platform that uses an artificially intelligent avatar guide, 3D augmented reality interactive models, and games to reduce anxiety for young patients undergoing medical treatment. I'm going to start with a short demo, and then I'm going to talk about how we're using the metaverse to support the whole family when a member of that family is going through treatment for serious illnesses. But before I get into that, a little about me. I'm a designer by background, and prior to Exploro, I spent the last 30 years owning and managing digital and creative agencies. I've been involved in metaverse projects since the start, and way back in 2007, my agency became one of only 35 Linden Labs Gold solution providers, developing immersive virtual world content for global corporate and educational brands in Second Life. But Exploro comes about through personal experience. In 2011, my then 13-year-old daughter was diagnosed with cancer, and it was her experience of going through treatment that led me to realise that patients need better information, and if they get that, then they have a better chance of improving their outcomes. My daughter's 10 years cancer-free now, but patient information and education is still diabolically poor. So this is Exploro. It doesn't require any special hardware, and it's designed to sit on the patient's own device, whether that be a mobile phone or a tablet. Firstly, the patient creates and customises an avatar, which then becomes their friend through their healthcare journey. At any point, they can choose to see their avatar in the real world, and that helps to strengthen the bond between patient and avatar. The avatar guide is also an artificially intelligent chatbot, and we've built it from the ground up with the needs of those with developing literacy skills front of mind. So if I ask my avatar, will my operation hurt? It understands my phonetic spelling. If a patient knows what to expect before they come into a healthcare setting, they feel less anxious. So in Exploro, we introduce patients to environments using 3D augmented reality models. If I tap this red balloon here, my camera is activated, and once the balloon turns green, you can see a 3D augmented reality model of a hospital environment. And that environment is inhabited by my avatar and those of all the other patients in the hospital. No visit to a hospital is complete without coming into contact with complex and often scary technology. Take MRI scanners, for example. Here my avatar is introducing us to an MRI, and if we tap this button, we can see what all the component parts do. As I tap forward, my avatar explains the whole process to me. And as the control room comes into view, you can see a monitor there. If I tap the monitor, we can see what an actual MRI scan looks like. We use games to deliver what we call stealth learning, as each game plays on an aspect of the child's treatment and helps them to understand more about it through gameplay. Some of these games are multiplayer, and that helps children form social bonds with others in the hospital. Strictly speaking though, none of these features really qualifies Exploro as a metaverse application. Sure, we've got 3D virtual environments and augmented reality and avatars and whatnot, but what's missing is social interaction. That's because social interaction, particularly where children are concerned, is inherently tricky and requires strict safety controls and potentially 24/7 moderation. However, we're building a new feature that will turn that on its head. Ever since my daughter was ill, I've been interested in the psychosocial needs of siblings. We know that they experience feelings of guilt, anxiety, loneliness, jealousy, and resentment, but there's virtually no provision to support them. So when a parent gets an access code to Exploro, we're going to grant them codes for all of their children, not just the sick child. That way, each child in the family can have their own instance of Exploro. And because the parent has authorized that, it allows us to do some really cool things, like meeting your brother and sister's avatars in augmented reality, sharing hugs and messages, sharing calendars, and playing multiplayer games together. At that point, Exploro becomes a holistic metaverse application supporting the whole family in their own engaging and safe virtual world. Thank you.
Wonderful. Dom, do we have you on the line?
We do. Just turning on.
Hello. So for everyone who's tuning in, there should be a poll that has popped up at the end of each startup pitch. Let us know if you want to get introduced to any of the startups that you see, whether you have any questions or you're interested in learning more about them. So while you fill out the poll, Dom, I have a few questions for you. How can I get to see Exploro? Is it available on the App Store or where can I find it?
Right, so it's available through subscribing hospitals. So although you can download the app from the App Store, you can't access it without an access code, which will be given to you by one of our subscribers. However, if there's anyone on the call who's interested in a demo, I'd be more than happy to arrange that. And I can put my email in the chat.
Sounds good. And how many hospitals is Exploro working with?
So we're working with 3 hospitals in the United Kingdom, a hospital in Spain, we're working in a hospital in Ghana, and we're working with about 5 or 6 hospitals in the United States.
Wonderful. And are you raising?
Yeah, we are absolutely raising. So if there's any investors in the house, I'd love to have a conversation with you.
And last question, what is your roadmap for future product development? Like, what does that look like?
Yeah, so I talked in the presentation about our siblings content, but we're developing lots of other stuff too. So one of the things that we're focusing on is developing content for a wide range of disease areas. So we currently support cancer and a various range of treatments, but we're looking at diabetes and respiratory and so on and so forth. But we're also looking at how we can build Exploro into a platform that can hold content developed by other content creators. So video content and game content created by third-party developers.
Wonderful. Well, thank you so much, Dom. That's all the time we have for questions.
Thank you.
Really appreciate it. Great. So up next, we have MediView. So they're redefining the cancer continuum. So let's welcome MediView.
Hello, everyone. This is Mina Fahim, CEO and President of MediView, where we are simplifying surgical procedures with X-ray vision. It's an absolute pleasure to be with you all in the Healthcare in the Metaverse webinar. Very excited to share with you how MediView is empowering clinicians with X-ray vision with intuitive visualization, seamless collaboration, and evidence-based insights. Today, 3 out of every 4 patients suffering from soft tissue cancer, such as liver cancer, kidney cancer, has to settle for suboptimal treatment options. Either chemotherapy, open resection, invasive treatments, or forego treatment altogether. There is a better option, minimally invasive ablation procedures. However, only 1 out of every 4 indicated patients find their way through the referral pathway to these less invasive procedures today. And you ask yourself why. Today, the current image-guided tools that the clinicians have are insufficient to help them see where they're going. They struggle and say, I can't see where I need to get. They're trying to solve these inherently 3D problems in their head using 2D black and white imaging and tools. They're doing these mental gymnastics trying to convert black and white 2D images to what's happening in 3D in the body. On top of that, they're looking away as they're practicing. You don't drive down the highway looking away from you because you know you're going to drift into the opposite lane. That's how medicine is practiced today. That accounts for $120 billion of economic impact in the US alone attributed to ergonomic injury relative to medical procedures for our clinicians, which inherently impacts their ability to best deliver care to their patients. On top of that, they don't have a simple way to phone a friend to get a second opinion during a procedure. That's where the metaverse and MediView come in. We are merging the physical and digital worlds to advance healthcare through intuitive visualization, seamless collaboration, and evidence-based insights. Imagine if you could see underneath the skin while actually performing surgery. Today, you don't have the ability with current image guidance tools to see very intuitively where a tool is intersecting a specific anatomy. Imagine being able to layer anatomy on and off, see where your surgical instrument is going, plan its trajectory before you ever puncture the skin, and then actually see interactions between the tool's position and anatomy in real time. Soft tissue holographic registration is MediView's competitive differentiator with our transformative vision. Current image guidance solutions is about a $6 billion market. The place where we are working today is in the US, serving oncology, cardiac, and orthopedic procedures, and specifically those applications that are being performed using ultrasound, CT, or fluoroscopy. We really picked a starting point with a minimally viable product where we are generating revenue today to help reduce that burden of ergonomic impact in the OR. We're well on our way to ease the transition to the healthcare metaverse with some incredible clinical and imaging partners such as the Cleveland Clinic and GE Healthcare. MediView has separated itself in a very exciting landscape. We are the only company that can position holograms of soft tissue underneath the skin in a trustworthy enough way to guide instruments to specific anatomies in real time using holographic guidance. We have an incredible team making this possible who have left destination companies to come make this journey possible of holographic visualization and navigation at MediView. We are a well-funded medtech startup, having raised $14.5 million to date. We have a number of issued and pending provisional patents, and we've shown this solution and gotten feedback from hundreds of clinicians from across the country and across the globe. We have great ongoing clinical evaluations where we've performed over 30 procedures in the metaverse with our AR visualization and collaboration tools. We're burning down risk from an FDA perspective with a number of registrations and 510(k) submissions, and we're generating early revenue in our space. We're looking for you to partner with us as we enter our Series A and help define clinical champions that want to help with the adoption of clinical XR. Thank you so much. Looking forward to our Q&A session.
Great. Mina, do I have you on the line?
Yeah, can everyone hear me?
Yes.
Hello, great to be on.
Hello. So I have a few questions for you. What is the technology that allows you to see inside the body? Does it work on all parts of the body?
Great question. So today we're using CT, MRI, and ultrasound to actually build up those patient-specific anatomies and then ensure that that hologram is sitting on top of the actual anatomy inside the body using the real-time imaging from either ultrasound or fluoroscopy. Your second part, does it work for any parts of the anatomy? Yes, it does. Our IP portfolio goes head to toe for any anatomy, any procedure. And then to connect the two questions, if you actually want to use different imaging modalities, our IP actually covers that space as well.
Wonderful. And then what would you say are your different revenue streams and how those are being managed?
Yeah, great question. So the business model really has two sides. There's the organic product development, which is unique products built on the differentiated IP that we are generating revenue with today. And what has organically happened is companies and clinicians have actually seen what we're building, and they've reached out to us and say, can you build this for my imaging system? Can you build this for my therapeutic tool? So that's what we call our contract partnership and development track. And there's some crossover on purpose to make sure that the platform scales appropriately, but then there's dedicated resources to both the organic product development as well as the contract partnership and development side.
Wonderful. And last question, quickly, what's the first application that you're going for and where does this work best?
So the first area that we're going after is the ablation of soft tissue cancer, such as liver cancer, kidney cancer, really to get more patients away from those invasive, harsh procedures into faster recovery and yet equally equivalent in efficacy in ablation, where the hindrance today is visualization and therapy confirmation.
Wonderful. Well, that's all the time we have today. Thank you so much, Mina, for joining us.
Thank you. I'll put my email in the chat for anyone that's interested in following up.
That sounds great. Thanks so much. Great. And up next, we have Aaron, who's the CEO of XR Health.
As you can hear from the accent, originally from Israel, a former F-16 pilot in the Israeli Air Force. I was diagnosed as suffering from whiplash injury due to the active flight and the G-forces. And then the idea came about to combine VR and rehab. And we believe that the outpatient realm will change dramatically, and XR will be the technology that will lead the change. As you can see on the right side, the outpatient realm, especially physical therapy, occupational therapy, but also mental health, basically looks the same in the last 300 years. And we believe that in 5 years from now, instead of walking into an outpatient clinic, you'll just put a set of XR goggles and you'll be able to transport to different types of virtual treatment rooms. And that's basically what we are trying to build. We are in full commercial mode. We have full platform, FDA registered, and a full stack of clinician interface and patient interface. But I think maybe the important thing is that we decided, instead of waiting for a healthcare system to adopt the technology, we took a leap of faith and we decided to be the provider also. And we are now a vertically integrated virtual clinics treating patients remotely using our own proprietary technology, all covered by the health plans. And since we did that shift, we are scaling relatively fast. We treated over 5,000 patients, completed over 200 VR sessions. We are now at a rate of VR session every 7 minutes. Very, very high patient adherence and compliance. And we will publish few papers this year to show that this is as good as, and in some cases better than, a brick and mortar treatment. We have 5 virtual clinics fully operational: Massachusetts, Michigan, Florida, Israel, and Australia. And we are about to launch additional virtual clinics in all the big states this year. We are in-network provider with all the big payers, including Medicare and Medicaid, and the private payers. 21 patents submitted, 4 already approved. Some of them we believe will be very important for the healthcare and XR arena. 50 employees globally, and we raised $22 million today. I'll show you a quick video just to give you a sense how our platform looks like. On the left side, you can see a patient inside a virtual treatment room. On the right side, you can see a clinician monitor everything remotely and controlling. while the patient is inside the virtual treatment room. We are monitoring everything: eye tracking, smoothness, peak velocity, efficiency, center of gravity, respiratory. Everything can be completely customizable remotely by the clinician. The clinician can transport the patient to different types of treatment rooms, depend on the patient needs and condition. And at the end of every session, there are full analytics, so both the patient can see their statistics and the clinician can see their statistics. So this is the components of the different platform. Again, different types of VR application or virtual treatment room, patient mobile app that guides them how to use the VR for the first time, different types of virtual reality headsets. We have partnerships with multiple VR manufacturers, and the patient is getting a only dedicated VR healthcare kit, no gaming, no entertainment, just a medical grade application and platform, and a clinician external control that allows the clinician to control everything remotely. The reason why we believe the entire platform will change the outpatient realm as we know it is because in the outpatient realm, you have different problems. It starts with accessibility. You need to drive all the way to the outpatient clinic. You need to wait in line. Maybe clinician will spend 15 minutes with you. And we believe, again, those virtual treatment rooms can change the way that we are operating. Every time you're putting a VR headset on, you are stepping into a computer-generated environment that allows us to capture and analyze everything that is happening inside that virtual treatment room. And for the first time, enable us to quantify outcomes and then start comparing the patient results and their progress, but also to other patients that we believe are similar, and then analyze, which protocol are more efficient than others. Everything can be customizable, so the treatment room can be fun and engaging. Like you saw, you can be in the circus, you can be near the sea, and by doing so, improve compliance and adherence. And everything should be fun and engaging. So that's basically where we are. We would love to partner with anyone that is interested to incorporate the technology into their facilities. So now we are transitioning from not just running our own virtual clinic, but also helping other clinics to become XR Clinic. And we're looking for partners. And obviously, like any other startup, we're also looking for investors that are believers in this technology.
Wonderful. I see a few. Aaron, do you have early progress metrics that show outcome improvements?
So we have more than a few. Again, we'll publish a lot of those. We are trying to compare ourselves to a brick and mortar clinic. And today there are different types of metrics. How do you measure a brick and mortar clinic? Mainly patient reported outcomes. But on top of that, we are also doing evaluation every 30 days based on the clinician. We have all the VR data that you saw. There's a lot of data showing progress. We are monitoring constantly compliance and adherence and medication and quality of life. We will publish all of those results. Again, it's in the works and waiting for feedback from the papers.
And how can someone sign up and get VR treatment?
So it's actually pretty easy. In the state that we are operating, patient can just go to our website and sign up. One of our clinicians will do a video call to make sure that they are suitable to use VR. Assuming that's the case, we're shipping them a headset. They are downloading the mobile app that guides them how to use the VR for the first time. And then they are conducting those virtual treatment as you saw in real time. In between sessions, the patient can use the headset on their own based on the guidance that the clinician gave them. And maybe the most important thing there, it's exactly on the patient side, the reimbursement and the coverage is exactly like a brick and mortar clinic, which for us at least, that was the biggest barrier and when we launched the virtual clinics.
Definitely. And last question, what are the use cases that you're treating?
So in the US, we're focusing on pain management. I think pain management is probably the biggest vertical across the VR industry. I think there are more than 1,000 papers showing how effective it is. So we are seeing the same thing in our clinic. We have in Australia very, very good results with autistic kids. We are starting to see very, very good results with the stress and anxiety. and neurological disorders, especially Parkinson's and MS. Again, we're starting to see pockets of use cases that are very, very, that the outcomes we believe will be by far better than a brick and mortar clinic.
Wonderful. Well, thank you so much, Aaron, for joining us. That's all the time we have for questions.
Thanks for having me.
Really appreciate it. Up next, we have 8Chili. 8Chili is an experiential platform for learning and collaboration. So let's welcome Aravind from 8Chili.
I'm Arvind Upadhyaya, founder and CEO of 8Chili. We are a Bay Area-based medtech startup that is reimagining reality by developing the world's first training and collaboration platform that uses virtual teleportation. The Hint VR platform is powered by our patent-pending headband and an AI-powered content management system. The headband is powered by the industry's best stereo camera and a robust design. It can support existing surgical attachments that surgeons use in the operating room, like surgical headlamps and loops. It weighs less than 100 grams and captures the surgeon's view of the procedure. It is disruptive but does not interrupt the current surgical workflow while capturing the surgeon's view in true interactive 3D. The Hint VR platform makes it easy for any healthcare professional to create quality 3D immersive content. Once the content is on the cloud, the AI-powered content management system enables segmentation and faster annotations. Finally, when the resident puts on a virtual reality headset like a HTC Vive or a Quest 2, they get teleported into the surgeon's perspective. They get to see exactly what the surgeon is doing as a part of the procedure, be able to overlay their hands, use the virtual instruments to understand the nuances of the surgical procedure. Our platform has received rave reviews from our first users and pilot locations. The only word that we have heard is relive the experience. That has been consistent with all the users who have experienced the Hint VR platform. We have successfully proven our technology to eminent healthcare professionals at WVU Medicine, MSU Medicine, and the Global Robotics Institute. We also have a very healthy pipeline of requests for deployment of our training and collaboration platform. We have successfully raised $1 million as a part of our seed round. Now we are looking to raise $10 million as a part of our Series A to bolster our growth and R&D activities. For any innovative idea to succeed, you need a strong team. And I'm lucky to have Amit as a co-founder. Amit is a serial entrepreneur, has spent the last 2 decades bringing multiple devices through 510K. I'm a technical founder. I've spent the last decade bringing concepts to market. And I'm supported by Mo Bharathan, who's the Chief Operating Officer with a wealth of experience on the engineering and cloud and R&D side, and Abita, who brings in the flair for corporate relationships. And we are supported by a strong advisory team of surgeons who believe in our product philosophy. At 8Chili, we are excited to be a part of the plug-and-play ecosystem. We look forward to seeing you all on the demo day. Thank you so much.
Well, good. Well, we have a few questions for you. I see in the Q&A, someone asked, how do you measure success with 8Chili?
Right. So we have a couple of metrics. So one is the assessment is built into the platform. The way we go about measuring, skill acquisition by recall, or like how does a habit get formed? Let's say when you have to do steps 1, 2, 3 in sequence when you're faced with a specific situation. So some of these things are encoded. We have we have a cloud enabled learning management system that allows our providers or our clients to put in their own validation or assessment metrics that get captured.
Wonderful. And then what has been the initial response from your early adopters?
I think it's like we're a rocket ship that's just going, that's hit escape velocity, I would say. We've trained so far, more than 1,000 professionals. We've logged in 3,000 plus hours on the platform. We have training procedures created across specialties, from oral and maxillofacial to spine and neuro, and more importantly, nursing. We've been approached by some of the biggest organizations to help them adopt the new curriculum for nurses, right? Like there's a huge shortage, as everybody mentioned. I think the way our customers see that is, they can create original content and be able to bring that content into a part of the curriculum. So yeah, I think that's where we are right now.
Wonderful. And are you planning to create a healthcare hands training marketplace for the metaverse?
That is the final goal or the vision that we have set. So right now we have our partners creating content to help train their own residents or staff or students. But eventually, once we have enough content, all of this will go into the marketplace. So there could be a U of A, Aztec, or an Apollo. Think of it like a hands-on training marketplace, something like Coursera, but for healthcare professionals.
Wonderful. Well, thank you so much for joining us. That's all the time we have for questions. Really appreciate it. I think there's a few questions in the Q&A if you wanted to stick around and answer.
Sure. Thank you.
Great. And last but certainly not least, we have one of our Batch 14 companies, Vital Start. They're a maternal mental health platform using AR and VR. So let's welcome Vital Start.
We've all heard of the 4 vital signs: pulse, respiratory rate, body temperature, and body pressure. Today, I'll be unveiling the 5th, the vital sign for well-being by Vital Start. Our initial focus is on maternal mental health, an area that's really close to my heart. I've personally been through postpartum depression and come face to face with the discrepancies in the healthcare system and the stigma associated with it. Hi, everybody. I'm Kirtika Parmeshwaran, a Wharton alum, and the founder and CEO of Vital Start Health. I have deep expertise across business and technology and a passion to address this issue through innovation. I'm joined in this endeavor by Dr. John Cho, a neonatal quality officer at the Children's Hospital of Philadelphia and an associate professor of Penn Medicine. We are a University of Pennsylvania company, also part of the Microsoft for Startups program and funded through the University Science Center. Perinatal mood and anxiety disorders is the #1 complication in pregnancy and postpartum. This is an $18 billion preventable problem in the US and an enormous opportunity globally. It costs $19,000 for PMADS treatment per mother and can take over 5 years. We want to disrupt this completely. We've launched the first maternal mental health platform using virtual reality for equitable, clinically guided, and personalized care using the Vital Start Wellbeing Profile. We're a one-stop shop mental health platform that is multilingual and that is catering to the complete maternity spectrum. We have a 5% Give Back Health Equity pledge and a strategic vision of impacting over 1 million mothers in the next 10 years. A unique advantage we have is our relationship with a leading NICU in Philadelphia, where we have completed our initial clinical studies as well as licensing and content generation. I'm excited to share that we recently won over $50,000 in awards. Why VR? The American Psychological Association has recommended VR for different mental health conditions. And using this body of evidence, we're furthering this with clinical validation. Our platform, Courage, uses VR as a key enabler and differentiator. We have 3 prongs: the program, care protocol, and content, the virtual care platform with analytics and telehealth, and finally, the practitioner network of coaches and psychologists. Here is how it works. Let's consider a high-risk pregnant mom, Jane Doe, who is going to be needing a NICU tour. Jane is very anxious, and is already feeling the fear of birthing and postpartum. The NIC is equipped with the Vital Start Courage platform and is able to utilize that to calm down Jane and provide psychoeducation as well as relaxation techniques to help Jane in her journey. The Courage platform has a team-based approach. The care coordinator schedules an appointment between Jane Doe and the practitioner Bob Smith. She also assigns activities which include content, journaling, and support materials, and also assigns different screeners for Jane to complete. Bob uses the Vital Start Wellbeing Profile for Jane to help curtail the curriculum for Jane. The Vital Start Wellbeing Profile is a unique scorecard that normalizes Jane's longitudinal data of progress and gaps in the treatment. At the scheduled time, Bob joins the meeting through the Courage portal. Jane is excited at the same time to be able to get the support that she needs. Readying the VR goggles, she too joins the meeting, the telehealth session through the Courage platform. To help Jane build her own personalized practice and to calm her nerves, Bob's begins with a relaxation and mindfulness exercise using a core VR experience on the platform. Along with VR content, there's also audio and video material that a practitioner can use as they choose. The platform drives value for all the key customers, including the patient, providers, employers, payers, and pharma. There are many ways to do mental health. A key differentiator that we are bringing to the table is combining this with experiential practice using VR as a key modality. Our go-to-market strategy begins with B2C and then B2B, even as we grow our partnerships across the maternity ecosystem and patient advocacy groups. Our goal is to provide one-on-one coaching and psychotherapy, as well as group VR experience, and focus on loss and grief, tough areas in maternity where there are not many solutions available right now. We've generated funding of over 300,000, forged partnerships, grown our team and practitioner network, and we're now ready to go after $41 million in revenue by 2026. To do this, we are going to be raising a $3 million seed round. That'll go towards growing the team significantly, focusing on sales and revenue, and completing our clinical validation for VR exposure therapy. We have a unique, scalable Web 3.0 ready platform, a stellar team, strategic, socially impactful vision, and an enormous opportunity. The timing is just right. There's a huge need for mental health, as well as a huge awareness for maternal mental health needs. Join us and support us to become the vital sign for maternal well-being. Thank you.
Wonderful. Kirthika, do I have you on the line?
Yes, absolutely, Eva. I'm excited to be here.
Hi there. So I have a few questions for you. And again, for the folks in the audience, a poll has popped up. So if you're interested in connecting with Kirthika or Vital Start, mark yes. Kirthika, so are you planning to develop all of your own content here?
What a great question, Eva. I know that there are phenomenal companies out there, and there is just, intriguing content out there as well. So right now, all the content that we have on the platform, yes, we have our own production house, we've developed that, but we've also done licensing and some content generation at the Children's Hospital of Philadelphia. Similarly, we are looking to generate and license content from other institutions, other players in the space, because for me, the key here is to get the outcomes in place for all the moms out there who need this. And that's really the core vision for our company, to provide equitable and personalized care. And we're completely open to licensing content, working with other companies, partnering on this. Looking forward to hearing from all of you.
Wonderful. And is there a certain instrument that you're planning to use for your seed raise and your fundraise?
That's a great point. I mean, we would like to go for a convertible debt or a price round, but we're totally open to different kinds of instruments. Very interested in hearing from investors as well in the audience. We are keen to begin this round, grow our team, and just get out there. We have so much momentum right now. I just feel this is the right year for us. Thanks so much, Eva. I love this opportunity.
Of course. I have a couple more questions. How do mothers access Vital Start?
Right. So right now, right through our website, you can go and get an intro call. It's completely free. And as part of the intro call, we help moms on board onto our platform with a care coordinator in the loop. We feel very strongly that mothers are vulnerable in the state, and we want to provide them some hand-holding to get them on this journey. And that's how it'll happen. It's a cloud-based platform. We're part of the Microsoft for Startups program. So you have the complete stack, and it's really simple to use. We have both the B2C and the B2B, so you can come in through a provider, or you can come directly to us. We want to cater to all the moms who need this support whenever they need it and wherever they are.
Wonderful. And last question. So someone asked, Web 3.0 is still being defined. What strategies have you adopted to be agile and to be able to pivot in such a new, tumultuous landscape?
Wow, that's such a phenomenal question, because we've done a lot of that already. We did start with Oculus and, HTC Vive and all the big, fabulous headsets, but very quickly realized that, especially in the maternal health space, there is this, there is no way to get reimbursements from the payers for these things. And so when COVID happened, we actually pivoted into low-cost VR, mobile VR, and it's a really beautiful headset, looks like an Oculus Go, feels like an Oculus Go, but obviously, is not able to do some of the things that you can do on the high-end headsets. But for the kinds of things we want to do, we feel very confident that we can do that right now. But at the same time, we're keeping an eye on the future and building this, on the cloud so that we can easily transition into the higher-end headsets as well, depending on the different locations and institutions we'll work with. Completely open to different modalities. Again, the focus is on outcomes, and all the modalities that would be needed, we will be ready and equipped to do that.
Wonderful. Well, thank you so much for joining us. That's all the time we have for questions with you today. Really appreciate it. Great. And for everybody who's still on the line, I know we're a few minutes over, but we'd really appreciate you filling out our webinar survey. If you liked what you saw today and there's maybe some other topics that you want to see from us and you want to explore or dive deeper into, please let us know. My email is on the screen here. So if you have any questions, feel free to reach out to me. We did record the session. So if you registered, we'll be sharing that recording with you very soon. We're excited to see some of you at our summit. So let us know if you're interested in coming to that. And with that, we'll see you next time. Thanks everyone for joining us.